Nice. Live streamed. Perfect.
Yeah, we're going live. All right, everyone.
Nailed it.
Welcome to Perfect 10 P. Welcome to Blueprint for Peak Performance. Ask me anything. I'm Brandi Smith. I'm the founder of Perfect 10 PT Academy, online courses for parents, coaches, and athletes, as well as Perfect 10 physical therapy and performance training. For those of you who don't know me, I'm a physical therapist and performance coach. I work with athletes from recreational all the way up to Olympic level. We even have some preschool curriculum programs as well. So we work the whole gamut. And I'm excited today. So our blueprints are here for free for coaches, parents, and athletes to get as much information to help make our athletes and our interactions with our athletes, whether we're a coach or a parent or a provider, healthy and well educated with all the aspects of performance. So we have some really cool guests coming in from now till the end of the year. We're going to have a bunch of guests. I'm going to pin myself. I'm realizing I didn't do that. So we're going to have a bunch of guests coming in for the end of this year, from now to the end of the year. Everything performance, from nutrition to resistance bands to some coaches coming in with some really cool drills for gymnastics specific. Some really actually awesome coaches. So stay tuned and pay attention. We will be changing the link. So make sure if you have been saving this link, we will be going to a new link starting next week, and it should be updated on all of our follow-up emails as well as on our Instagram profile for those of you that are using it. Come on in, Latifa. All right, so without further ado, I'm excited to introduce, we've had Elaine on once before, and at y'all's request, we had her come in again. Elaine Tsay is a physical therapist who specializes in moving heavy things, basically. She's a former gymnast, and Elaine and I have known each other for many, many years. She was a tech when I was a PT underneath me for a little while, and she's an amazing physical therapist, went through the same fellowship program that I did, and also has some of the same mentors with Shirley Sarman, for those of you who are in the physical therapy world, the movement world of stuff. So Elaine is here. We are going to talk about periodization for all ages. So training periodization for all ages and how we include weight in training for gymnasts. So Elaine, I'll let you do a little bit better intro than I did. And then I'll let you take it away.
Yeah. So my name is Elaine, like Brandy said. I am the co-founder and one of the main PTs of PT Liftology. I am currently working full-time now at a standalone practice. I worked in a clinic setting for about 11-ish years, and now I've kind of branched off and am now running my own practice. I also teach continuing education courses to other physical therapists to help elevate our profession. Myself and my co-founder were we attended some of these continuing ed courses, and it's necessary. We have to do this every 2 years, and we were attending one of them, and we were like, "Oh my goodness, guys! Like this is not good enough for our profession. We need to do a better job of being better clinicians, but also promoting mainly what we believe in, and Brandy can attest to this, as movement. I think we in our profession have this like weird turning point where we have a lot of old school way of thinking of where everything is just like we got to isolate muscles, we got to strength train, we got to do this, but they're kind of missing the mark when it comes to the whole picture, compound movements in general, and then also I think because Brandy and I work with so many athletes, being able to put everything together and look at everyone as a whole and not someone just as a body part. Like, say someone has like knee pain, you can't just look at the knee, you got to look at everything else. So, what we're going to discuss today is a little bit of, Brandy was saying, is periodization and a little bit more of detail about what progressive overload actually is and what it means. This is a term that I think if you're on Instagram, on YouTube, on any kind of social media, that gets tossed around quite a bit, but I don't think people have like a really good understanding of what that actually means. And from a periodization standpoint, it needs to be in a stepwise process to where you're not overloading tissues too much, too fast, too soon, or underloading them, because I think I've seen, and Brandy can attest to this too, is that especially with dynamic athletes, so cheerleaders, dancers, gymnasts, people who do martial arts, they're loading their tissues to where it's upwards up to, 10 to 15 times, even sometimes more, their body weight. And this is on joints that if you're not training your joints to be able to load that amount, they are not prepared for what's about to happen. And that's when we lead to some tissue breakdown. And that could be either the tendons, that could be the ligaments, that could be the joint surfaces themselves, that could be a meniscus, that could be a disc, whatever those soft tissue structures are. So
And a growth plate in the growing
growth
athlete.
plate, yes. So there is such a thing as underloading, which I see quite a bit of, I think, in sometimes the dynamic athletes, the ones that are landing on surfaces from a height, and they're not quite preparing their athletes for what's about to happen with their joints.
One of the things I wanted to talk about that. So, Elaine, one of the things that I've been talking a lot about lately is this idea that we have these amazing equipment in the sport of gymnastics that is
Mhm.
to decrease our impact, right? So we've got
Correct.
tumble track and air track, and we've got stage
Correct.
mats, and a lot of this happening where they have their place. They're really important pieces of equipment to utilize. But I think, just like anything new happens, there's a pendulum that swings. And
Correct.
we have overutilized these low impact landings. But in the
Yes.
end, when you compete, you have to compete on a hard surface. And if
Yeah.
you're an elite, you're landing 22 times your body weight if you're tumbling. If you're like a level, 6 or 7 or a level 5 doing a round up handstand back tuck, just that's give or take between the fact that running is 5 times your body weight to lead or tumbling,
Correct.
standing back can be 5 to 10 times your body weight. You're landing 10 to 14 times your body weight. And if you're used to low impact, and the other aspect is even the biomechanical changes that happen on the lower impact surfaces that have a
Yes.
larger and slower dishing effect than the floor.
Yes.
There's a lot of time for things to collapse, a lot of time for some bad habits to kick in and let the lower impact equipment do the job for you. And then
Yes.
you take those technique breakdowns and you put them on a hard surface. And
Sure.
number one, it's like a recipe for disaster because you have some mechanical issues that have declined with poor mechanics. And then you have an impact on tendons, ligaments, bones, joints, growth plates that also declined. And if you spent a lot of time there and you weren't doing anything opposite of that, now we're saying, yeah, you've got that technique down. You've got that round off layout down. Let's go to the hard surface. And now all of a sudden we've got these bad mechanics on
Mhm.
higher impact on tissues that haven't been impacted for several weeks at a time. So I think one of the goals that I would like to kind of put out there in the universe is for us to find the happy medium of
Yes.
utilizing our lower impact equipment to help us get more numbers in, but at the same time, and also air awareness. I mean, it's great for air awareness and stuff like that, safety. But at the same time, still loading, staying on top of the loading.
Yes.
So that's part of what
Yes.
I'm excited we're going to talk about.
And some of those notes you'll see that I kind of wrote on there is training these specific exercises and loading your tissues on various surfaces, right? Being able to kind of like do your isometric kind of like holds on a tumble track, like that's great for balance standpoint because that changes your proprioception and your mechanoreceptors in the bottoms of your feet. You can do that standing on both legs, standing on one leg, tumble track, landing mat, folding mat. Like there's so many ways that you can utilize, like you were saying, those different surfaces, and they have their time and place. But you don't really want to then kind of over utilize. It's the same with like runners who wear super duper cushy shoes, and they do that when they're running, but then when they wear like a normal pair of shoes and they're like, dude, my feet hurt all the time. And I'm like, well, because you're not really training your foot to then absorb shock in different ways. And that's how you can kind of change a little bit of the intensity of what you're training. And that could be as simple as just standing still, right? Like you're changing the surface and you're changing what muscle groups that you have to then utilize. So overutilization, I think, of sometimes those like lower impact things can be pretty detrimental. Now again, has its time and place, and especially of you're trying to build some of those numbers, and or your athlete is in that kind of like of the 0 to 10 scale, maybe they're at that kind of like yellow flag kind of phase instead of like the red flag phase, where it's like, okay, we still can load your tissues, but maybe kind of just decrease a little bit of that impact. By all means, let's use a landing mat. But yeah, I was kind of one of those athletes too. Like I like a lot of my tumbling passes, I would kind of over rely on the sting mat, even though I don't really need it. But it was to the point where when I was competing, I would like relied on it. Like I like really was like, okay, I can't do the skill without it. But in reality, I could. I just chose not to. And that kind of ended up in the pits there when I ended up rupturing my Achilles tendon. So there's that. So I'm a
Yeah.
walking, talking kind of example of overutilization of a lower impact landing surface that like I kind of over relied on.
Well, and at that time, you weren't really, how much weights were you really doing, or like heel raise or jump mechanics weighted or any of that stuff?
None of that stuff. Because
Right.
at that point, when you're in your collegiate years, right? Like for us, like being on a club team, we didn't even have a coach, right? Like our person was there just monitoring us, making sure that we weren't injuring ourselves or severely injuring ourselves. And then they kind of let us decide on what kind of conditioning we were doing. And even if we were doing conditioning, it was just your normal, like kind of like core based conditioning, but it really wasn't like, hey, let's get you on like a body weight back squat where you're just kind of really loading your tissues. And at that point, especially when you're in your 20s, right? Like you're pretty much skeletally mature enough to where you should be able to load those tissues, and you should be able to load them pretty darn heavy without actually being detrimental to your joints. And it's going to help your explosiveness, it's going to help your capacity to actually take load. And so I think a lot of now like elite level gymnasts and even cheerleaders, martial artists are doing a better job, because I think the research is there now of how important it is to add the resistance training and to take kind of a little bit of a day off from full impact and like kind of really working on the muscle, like the muscle brain connection, but also really honing in on the proper mechanics. Slowing movement down is also a way that you can kind of train some of the intensity. So say someone's having a little bit of like knee, like patellar tendon issues, especially when they're landing, you can really load them, do a slow, steady, controlled like lunge, and isotonically load those tissues with or without body weight. And you can do that for multiple reps to really build some of those tissues up. So I think there's a misconception that just because you're doing a very specific sport, that you need to only practice for the sport instead of training a little bit more compound movements. I think gone are those days where it's like, oh, you shouldn't do weight training because you're going to get bulky or whatever those misconceptions are. The research is there that we got to load our tissues, and we got to start doing some resistance training through multiple planes of movement, right? Like not just kind of frontal plane or sagittal plane, but definitely some transverse plane movements too, especially when it comes to some of your tumblers. They're twisting, they're landing, they should be able to take some load. And give or take that, if they do have a little bit of some of those mechanical issues, it kind of makes sure that your body can tolerate a little bit of that like wiggle room, so that way you're not potentially harming yourself. That is there, if you do land with a little bit of a twist, that your tissues can still tolerate that. So I think like loading in those transverse planes is a little bit scary, I think, for some athletes, because they're afraid of, oh, like, I think those twisting movements are what they tell me to not do. Because that's going to harm my tissues. But if you really train them to be able to load that way, then it's actually relatively safe. Brandi, like I don't know if you can attest to that. If you add some like really different planes of movement to some of your athletes as well.
Oh yeah, I'm a proponent for what we call, first of all, increasing your movement literacy in order to
Yeah.
have a huge movement menu. I am a proponent for a variety of training, like what variability can I add to this? Like whatever it is, like I wrote an article on 108 ways to squat. Like it's like,
Mhm.
it's like, how can we just make it different so
Mhm.
that if you have an ability to be strong and also save yourself in, various positions, deep squat, middle squat, feet turned in, out, asymmetrical, one-on-one piece, one of the worst things is landing on the edge of a mat, right? So can you
Yeah.
control different heights of surfaces on one side versus the other side of the body? Um, all of those different ways. So I'm a proponent for whatever exercise we do, can we create variability in it and make you strong in as many positions as possible so that you have lots of options. So yeah.
Yes. And that's part of that progressive overload, like that chart, right? Like there's many ways that you can kind of change and change up the exercises themselves. You can change the intensity of said exercises, right? So the intensity can mean that you're changing like how much resistance that you're adding, right? Like let's say that you have like a blue band, like maybe bump it up to a black band, or if you're using weight instead of 5 pounds, let's add it up to 8 pounds. You can also change, like you said, the variation of said surfaces of that the person is loading onto, and then you can change their volume. So how many sets and reps that they're doing, how many number of workouts per week that they're doing that is specifically for tissue loading versus the sport specific ones. You can either increase or decrease your frequency, right, of training on those two. And you can also decrease your rest time. Now, rest time means like in between your sets and reps for like making sure that your tissues, granted, like tissues do need very specific amount of time to recover within sets and reps. But if you're getting up to that point where you're doing like more sports specific, you're going to need less rest. So you need to kind of train with less rest. I think that's another proponent that I think a lot of coaches kind of miss is that when you are getting into like that competition season, it's like, okay, your athlete needs to be able to perform a routine. Then take gymnastics, for example, that's going to be at least a minute and a half. Is can they tolerate a full routine with those tissues without having to need that amount of rest? So if you're not training, right, like a decreased rest period, like in your training protocol, you could be kind of doing a little bit more harm than good by getting in some of the volume. And then with that, you can change your exercise selection, right? Variations of different planes of movement, variations of different surfaces, weighted, unweighted, adding kind of one arm, opposite leg, same side, whatever it is to switch it up a little bit. So when it comes to, especially because I think previously we really talked about tendons and tendon loading and the different phases that you need. There's typically four specific phases when it comes to tendon loading. Now, if you're in the off season, it's really important to take your time with some of these tendon loading exercises, especially the first 4-ish weeks in the off season, like when you're starting to like build them back up. And that's when you need to build some of their foundational strength training. And that foundations is a little bit more of like isometric exercises. Now, isometric means that you're kind of statically holding a position where those tissues are either in a shortened position or in a lengthened position, depending on what that person needs. Say it's an Achilles, right? Like, and they kind of like overstretched it in a eccentric loading phase. Eccentric means that you're like lengthening it. Then we need to work on kind of moving sometimes through that movement, and that's when the next phase of healing is going to be, which is, or sorry, next phase of tendon loading is going to be, which is then the isotonic, where you're actually loading it through the phases. Now, good examples of specific tendon loading, like for say like an Achilles or a patellar during those first 4 weeks is just a static calf raise. Like I'm not sure if some of your athletes and or as a coach or you yourself has done like a static heel lift. And although a lot of people actually do calf raises rather incorrectly, I do see them um, tend to do what I like to call as a little bit of a Michael Jackson heel raise where they just kind of shift their weight onto the ball of their foot and their knees are kind of like not fully extended and their pelvis is shoved through. That's not quite a heel raise or a calf raise. What I mean by a calf raise is truly the heel cup coming straight up, straight down, without any variations, especially with the forefoot. So I'm not sure if Brandi can attest to this too, is that so many people like perform what would be considered as like a kind of a rudimentary or like an elementary exercise highly incorrectly.
Yeah. Yeah. It's one of the most commonly poorly done exercises I've ever seen.
Yeah.
People throw their pelvis forward. So what you're describing, yeah, that pelvis rock, they use momentum and there's no
Mhm.
heel raise, no heel activation happening at all,
Yep.
no calf activation at all. So yeah, I like to put beans on their head and make them have to
Yep.
go straight up, and I'll even block them and say, nope, don't get the
Mhm.
rock. And they hit my hands. I'm like, no, you have to go straight up, you know. Um, but so what you were saying though, isometric, and then
Isometric, then isotonic. So isotonic means that you can load either the eccentric phase or the concentric phase or go slow and controlled through the movement, right? But that means full range of motion. So
yeah,
full range of motion, right? For like a calf raise, especially if you're talking about loading mechanics, it's not just at zero, right? It's going to be slightly below because of the fact that we're loading onto like a spring floor, which is like that mechanics
there's
is
a
actually
dishing, yeah,
below because there's a dishing effect.
dishing.
So that requires maybe having them on a slightly elevated surface to where they're actually getting a little bit more of that full range on the way down, full range on the way up, being able to kind of load the mechanics both. And a lot of people do the eccentric phase pretty poorly too, where the heel doesn't go straight up, straight down. Like
Yeah,
they might have a little bit of that heel kicking kind of like this direction, which is a little bit more of a supination, or where it goes this way, where it's a little bit
yes,
more of a
right.
pronation.
Yeah.
And that might require a little bit more of like an extensive, like say like Brandi or myself to come in and be like, hey, that heel needs to come just a little bit more straight down. There might be some underlying mechanical faults that need to be corrected first, but that's kind of something that you can just determine based off of if that heel is coming straight up or down. So yes, a lot of people just do those incorrectly. So isometric phase first, where you're doing like a static hold, either at the shortening portion or at the lengthening portion. I would suggest doing both, just especially during those first 4 weeks where you're really just trying to load those tissues at those ranges. Now, the isotonic phase, which is then like weeks 5 through 8-ish, leading into competition season, is going to be a little bit more of the slow, controlled movements through those ranges, and it's mainly to load those tendons. So you really want to emphasize full range. So that if it's an Achilles, right, that full heel coming up, full heel coming down. Now, if it's more for like a patella or like a quad, full squat mechanics, right? Full extension, full knee bending to really load both the patella and also the quad tendon there. And you can change the variation of those by doing two-legged on various surfaces and then also some single-legged, right? Because it's very like from a landing mechanic standpoint, you're going to be loading both legs. But if it's more on one side, you can kind of isolate it by loading one leg versus loading the other. Now, you can always change it up and do a combination of the two, which is very hard to do. Something like I know Brandi loves giving this actually a sneaky lunge, where you're kind of in a half lunge position, but you're also doing a heel lift at the same time or a calf raise at the exact same time. And that's going to be a little bit more specific for your tumblers who need to be able to like maintain those positions. So that's kind of those weeks. And then after that is where you really then build. So like week 9 through 12 is the strength and the power, right? Like that's where you start adding a little bit more dynamic, a little bit more explosive movements. That's when you start kind of introducing like the plyometric jumps, right? Like on floor where you do like bounding, you do like box jumps up and overs, you do a lot of those. You add in some jump rope, double leg, single leg. Um, You can add like jump squats with or without weight. You can do jumping lunges. Now it's for more like a triceps tendon or a biceps tendon, doing like plyo push-ups. You can do even dynamic chin-ups or pull-ups to like really load those tissues. So you can get pretty creative with some of your exercises, but the basic principles of those tendon loading are: first phase is more isometric. Second phase is a little bit more isotonic. By isotonic, meaning concentric and eccentric phases. And then you get a little bit more into your dynamic and strength and power. And then the last phase is where you go into more of the sport specific. And that's where you start reintroducing tumbling drills, vault drills, kind of the bar work, et cetera, et cetera. But don't I think a lot of times people rush through some of those phases without being a little like less specific of what they're training. Now, you can take some of these concepts, especially with your athletes who maybe don't have as much of the like acute inflammation, and you can kind of just progress them through these phases a little bit quicker than someone who is in a little bit more of an active inflammatory phase. Now, active inflammation means that that person is in pain and experiencing pain, or you see some swelling even if they don't have pain. That is an active inflammatory phase. So just make sure that you're not kind of like pushing them too quickly through these loading processes. And with that being said, tendons do need quite a bit of time, right, to heal. So allowing 36 to 48 hours worth of rest in between those specific tendon loading training sessions. And like at first, like 2-ish sessions per week of those specific tendon loading. And then you can ramp that up into like 3. But always, and Brandi will attest to this too, like before you load those tendons in that way, if you note that there is a little bit of a mechanical fault or positional fault, fix those first and then load those tissues. Now, I know as a coach, or sometimes even as a parent, you don't know if that person is kind of lacking some of those mechanical faults, and that's kind of might warrant like, hey, let's reach out to either like to Brandi and just be like, hey, can you take a look at how my child or my athlete is loading, and is this something that we should correct, or is this something that just needs a little bit more specific strength or muscle control loading wise. Yeah, always fix some of the underlying mechanical faults first and then kind of load those tissues.
Yeah, I love that. That's probably one of the keys, is that someone could take all this weight stuff, and if you aren't loading the mechanics properly, so making sure that your hip, knee, ankle are aligned,
Yep.
that when you're raising up, your heels come up, when you come
Yep.
down, you land in a nice arch, you don't collapse, you don't overload. You know, I think gymnastics coaches in general, I feel like you guys have a good eye on things. And then, there are more details to iron out. But especially when you guys are working with the 10 to 14-year-olds, there's a lot of pronation that tends to
Yep.
happen. That's probably the most common thing. And so making sure that, when they're squatting, when they're landing, when they're jumping, that they're not pronating. And of course, when we're squatting and jumping and things like that, if we're loading for ideal mechanics, or we're loading to load a tendon early on, you want to have ideal, which would be hip, knee, ankle in a line, knees over the
Yep.
second toe, which we've talked about jump mechanics and squat mechanics here, but just kind of throwing out the basics of it. But at some point, when they are past the point of early recovery, or they're healthy, etc., you do want to do squats with your feet
Yep.
turned in and your feet turned out, and be able to let the knees go in and be able to control it. But that's not something you do at like your 1 rep max. Like that's like something you do
No.
with the lower loads, just to have variability. Just trying to be clear on like that aspect.
Yes, so I do allow, and again, like later in their recovery process, some of those variations, because you kind of want your tissues to be prepared to take on those different loads in different planes of movement, to give yourself a little bit more of what I would consider it as room for error. Now, I don't like to limit my athletes to where it's like, okay, you need to have perfect mechanics, especially when it's later in those recovery process. Now, when it's pretty early on, first few weeks of the loading, we're looking for more, and I like how Brandi said ideal. Now, ideal doesn't mean perfect, right? Ideal just means that you're putting your joints in a position where your muscles, whether it be in an eccentric phase, which is the lengthening phase, versus the concentric, which is a shortening, is in the right plane to where everything is loaded in that way. Does it have to be 100% perfect? No, we are looking for pretty close to perfect though. And everybody's ideal is slightly different. So I think a lot of times we also have to take into consideration the person's angle of their femurs, right? Some people might be a little bit either retroverted or anteverted. Sometimes like having you force their knees to push out is probably not the ideal for that person. They might not be able to access their glute muscles or their quads or the hamstrings when they're actively pushing out like that, because they probably don't have enough of the femur control and or maybe the full range of motion to allow that to happen. And some people do have a little bit more of a valgus force. They're just built that way. So again, forcing their knees to just like push on out if they can't really control that, and then they're on the outsides of their feet, like that's not really loading their tissues there either. So what we're looking at is more like on those first few weeks of training, especially if there's an acute inflammatory phase going on, meaning that they're in pain, is controlling and limiting those extra little wiggles to like aggravate some of those tissues. Now, when they're later, go for it. Let's go ahead and kind of load them in those goofy ways and train them. But it has to be, this is, I know Brandi hints on this all the time, it has to be controlled. They need to know that those muscles are being utilized to get them in and out of those positions versus hanging out on their joints. That's another thing that we see quite a bit of, because we work with a lot of athletes who are on the rather limber side. And that limberness is necessary for said sport, right? But it has to be in a controlled manner. It can't just be, hey, let's willy-nilly just like straighten your knee out, like without any control. That's actually going to lead to a little bit of joint breaking down because you're just shearing your joints into position. So landing mechanics, loading mechanics, everything needs to be a little bit more ideal in those first few weeks. And then by all means, let's add some variation later down the road when you're in closer to like your sport specific training there. We kind of want that. So it allows a little bit more room for error. So ideal at first, right? And then start adding kind of those different planes of movement. So that way, if at any chance that you do kind of land on the side of a mat or on kind of the edge of the floor, there's a little bit of that buckling of the foot, your tissues are able to withhold that. Those first few weeks, probably not going to be able to withhold that because that's what that's what led to some of those tissues being aggravated in the first place. So kind of reintroduce some of those movements and then train them.
What all else did you have for us today? I know you said you had a PDF. Are you wanting us to share that today? Are you wanting to share? What is you, or what is your?
I kind of gave some examples of very specific like isometric exercises on those PDFs, and the attendees can kind of read through those. It goes over like the isometric phase of like calf raises, how you can really then change up the variation, right? You can do them fully extended. You could have the knee slightly bent. You can change the various surfaces. And then like there's a quarter squat in there, there's lunges, there's kind of like a plank hold or handstand hold, ringer bar holds. So it gives a little bit more details of like just kind of basic examples of what you could have some of your athletes do, and then how to progress those specific exercises depending on which phase that the athlete is in. So that's
Dawn,
all listed on there.
it's all listed on there. Yeah.
Mm-hmm.
Dawn or Carla or Latifa, did any of you guys have a question or
Like
thought or
specific questions,
something
yeah.
that that Elaine can help address? Yeah, Dawn, come on in.
So this all sounds like it's geared towards a comeback from an injury or a mechanical issue. Um, what
So a lot of these things can also be done as prevention.
Right.
So even if an athlete is not necessarily like currently experiencing any pain symptoms, but you definitely see still some of those little like, that leg kind of buckles in a little bit when they're landing. You can add some of these basic exercises in throughout training, even when it's in season.
Right. Is there, do you have insight on off season versus ramping up to season versus competition season so we peak?
Yeah, so off season is going to be a little bit more specific to doing kind of like rehab style, what I would consider as more rehab style exercises. More of kind of what we're talking about, what's very specific tendon loading, like those calf raises, those static squats, those lunges. Whereas when you're like starting to ramp up into the like competition season, you're not going to be as focused on doing as much of those isolated exercises. You're going to start adding some of the same muscle groups, but to a little bit more sport specific. And then once you're in like training season, or like once you're in the middle of like peak season, then a lot of those like rehab exercises specifically are going to be pretty like minimal, where they're like very isolated. It's going to be a little bit more towards the sport itself. So when they're like in the off season, go ahead and do very specific tendon loading and or tissue loading, where it's like not as much for specific. Whereas in the season, definitely do it a little bit more sport specific. You can get really creative with loading those tissues.
Carla had a question. Where do we get examples on how to do these exercises? Like, video examples or understanding, because that's so part of the how, I think
Mhm.
that's one of their questions, like how does the squat look like? How does the heel raise look? That kind of stuff. Before we move into that question, Dawn, did that answer what you wanted? Because I think what you're asking is,
Like specific exercises, like
well,
what,
hold on,
like
before we answer Carla, sorry, I'm realizing though, Dawn, did you get your answer completely, or do you have another caveat to that question?
No, I just wanted to make sure that this periodization, it sounded like it was being discussed as a recovery from injury. And I just wanted to make sure that the process kind of also applies
yeah,
in general to our population for prevention. And
yeah.
then that we're loading at the right time, backing off at the right time. Like that's what I was trying to get a feel for.
Yeah, so and Elaine, you can speak to this a little bit for me as for you as well. For me, when we're off season, that is a great time. Like immediately post season, like the first couple weeks should just be recovery and fun. The first like 1 to 2 weeks post
Yeah.
season, you've got to recover. You should be doing lots of active stuff that's just
Just
fun,
play.
active, and play. And
Yeah.
like it shouldn't even really look like gymnastics in reality. It needs to be counter gymnastics. Like
Yes.
if we were doing
Opposite.
multi-sports athletes, we would want them to do opposite movement patterns.
Yeah.
So like fun stuff, like some of my athletes, when they're capable and they're in the space to do it and the gyms will allow it, I'm like, hey, go rock climb, go swim,
That
go do something fun with your friends that's active,
bike
right?
ride. Yeah. Like
Yeah, go
anything.
bike ride. Yeah, biking. Like just do anything different movement patterns. So you can create like lots of game scenarios, lots of just fun activities in the gym that at that point don't look like gymnastics. They should be
Yeah.
so far from sport specific that it's like not recognizable, right? It should not look like gymnastics. That's the first 2 weeks. And then after that, you start to do a progressive loading phase, like she just talked about, where you progressively go, you know, isometric, you go all the way through and you can load them up heavy in the summer.
Yep.
Like that's when you can put weights on them and
Weight vest.
yeah, weighted vest and
Weighted vest.
really load them to where you're having to take a break, right? Like it's like, and You do have to counter and think about, though, when I'm working them out heavy, what does gymnastics look like the next day? So if I did like a lot of heavy legs one day, then the next day should not be a heavy gymnastics tumbling day. That might be the next day
A
they're on
bars
the
day.
tumble
Yeah.
track. That's when you
Yeah.
use your low impact stuff. Like
Yes.
we loaded them heavy. And then, and that can be a cycle throughout the summer where you're progressively loading, and you could, you can do it in different ways. You could do, a full body and then a break, and then full body, then a break. Maybe you load the full body 2 to 3 times that week, like depending on how many times your athletes come in, right? This isn't for your athlete that comes in
Yes.
once a week.
No.
If they're coming in summer and they're coming in once a week, then add in some heavy weights in the summer for them.
Yep.
Like you can load your 6-year-olds and 7-year-olds, like you can load them with heavy weights. And when I say heavy, I'm not saying heavy for them. Like the
Like
6 and
just
7-year-old.
heavy. Yeah.
Do what? Yeah, we'll say that again.
Yeah. Yeah. So like I think again there's this misconception that like loading someone who's there 6 or 7 years old with like even just like a body weight, like say like a barbell, right? Like a barbell's 45-ish pounds. Sometimes trainer bars are 15. You can have even up to 35 pounds. Say that your athlete like weighs 50-ish pounds. You could definitely put a little bit more load on them. Like their tissues will be able to tolerate it. Just think of
Well, their
how much.
tissues better tolerate it. They're running
Yeah,
5 times
they're
their body.
they're
Just your kid
loading
who's outside in preschool
that
at school running around, they're
that
loading 5 times their body weight, chasing their
correct.
friend.
So like being able to like load their body weight on a barbell and then have them do like a heel raise or even just a back squat is not going to wreck their tissues.
Yeah.
Like them just
But
walking
the take
around.
home though, the actual factor that's your limiting factor with your 5 and 7-year-olds, right? Especially your 6, I would probably, weight like a 5-year-old would be holding some like 2-pound weights or something.
Yeah,
But my daughter was like 3-year-old and lifting 8-pound
yeah,
medicine balls on her own. Like squatting down, picking them up, throwing them down. It was a
yeah.
fun game. And it was a soft medicine ball. That's fine. So you can do stuff like that with your little ones. That's good. But what I was going to say is that your caveat when it comes to movement with the younger guys, number one, I try to stay more functional than I do
Yep.
isometric, like isolated stuff, right? So you want to stay more functional with the younger guys. The other thing is the limiting factor is their ability to focus and attention span. So numbers
That,
may be low, and you want to set them up in a safe way. So like I said, my little daughter was 3 when she started lifting big, the 8-pound little ball that was a big ball for her and
yeah,
drop it down. She did 3 of those and moved on to the next little obstacle course she was doing. But that was her weights, right? Like it was fine.
yeah,
But you've got to pay attention to at the age range, like 6, 7, and 8 years old. What's their attention span? Can they do it with pretty good technique and form,
technique.
right? And really that's going to boil down to matching their weight, right? So like I like medicine balls and I like
Yep.
weighted vests for the
What the
little.
best. Yeah.
I will use like small dumbbells, like 5 pounds or, little dumbbells for little ones, as long as they can manage them. But, you have to try to set it up for a very smart way in that, if it falls on your toes, it's going to hurt. It's going to be a problem. And you try to set them up for a good scenario. Again, I really like weighted balls and weighted vests for little guys, especially in groups when you don't have the ability to
Yes.
really be with them one-on-one. But you can set them up and they do small numbers, right? And some of the numbers are limited not by the fact that their muscles won't do more, but by they lose attention span and then you lost the form. And so, and I like activities where they have to pick up a weighted ball and throw it
Yep.
into a
Throw
bin.
it back down.
Pick
Yeah.
it out of the bin and throw it into another bin, or maybe they pick up the weighted ball, sidestep, drop it in another bin. Like you find ways to make it a little game with the younger guys. So I just wanted to caveat that when with loading the younger kids, they can be games that you're loading, and it's not necessarily going to look like when you have your higher level older athletes, like maybe at 7, 8, definitely in the 9, 10 range, where you're actually gonna do like weighted squats. Like
Yeah.
Dawn, you've seen me do those with people, like whether it's with dumbbells because that's what you have in the gym, or you have a weighted vest or whatever. Again, you can set those in stations. You can do them as a group for your conditioning. But you would really want to slowly load them and peak them in the middle of the summer with their amount of weight. Like we're in the summer, so let's just say we're in a typical, because a lot of compulsories, Elaine, I don't know if you know this, are actually competing with optional seasons now.
Yes, yes, I've
They're
heard
doing
that.
that.
Yeah.
So that being said, if we're on that optional season where official season starts in January, of course we have some like little mock meets and stuff in December, and they finish up usually around April and May. Now, interestingly enough, if you're an Excel kid, they're finishing into June sometimes, and if you're a tumbling and trampoline
Okay.
kid, they're spreading out months between stuff and finishing like in July or August. Like it's really
Oh, wow.
interesting.
Okay.
That's a longer
The
season.
seasons
But
are
let's just
long.
talk. Yeah,
Yeah.
so they're a little off. So let's talk the kind of overall, most people are season January to let's say May.
May.
They start, so we take our 2 weeks off at the end of probably, let's just say the first 2 weeks in June. It might be the last week in May, but let's say 2 weeks in June. And then we're going to build ourselves up over the next 4 to 6 weeks.
Yeah.
Like, what would you give it?
Yeah, I would say like 6-ish weeks would be
Yeah.
kind of like that aspect, right? To like
And
lead you up into like the fall or like end of summer, beginning of
yeah,
fall
so
season.
June into mid-July. So like
Mid-July.
the
Yeah.
second week in July, give or take, you would be kind of peaking the athlete at their height of their strength training as far as amount of weight that they're
Yeah.
loading. And but then in those micro cycles of the macro cycle, right? So we're talking about a 6-week period. In there, you're going to create some variabilities where, depends on how often your athletes come in. Dawn, don't you guys have the group you're thinking of? Is it the group that comes in 4 times a week? Like let's pick one so we can kind of play with it.
Well, I work with multiple levels,
I
but
know.
I work with the younger ones, but they're only 3 days a week. So, but
Okay.
we groups that are 4 days a week, and
Yeah.
they have specific conditioning rotations
Yeah.
as opposed to just doing their strength and conditioning as parts of their event rotations.
And the younger guys, though, that come in 3 times, they have strength and conditioning as parts of their rotations at the events, right?
They don't have only on Fridays. Um, we can't use the tumble track during the week because it's full with all our rec classes, and our rec only runs Monday through Thursday. So Fridays is when we give everybody in the gym tumble track, and so they get a tumble track, and next to the tumble track conveniently are our stall bars. So that becomes a rotation for strength training. So we have a set of stairs, 2 sets of stairs, 2 ladder stall bars, and 4 bay stall bars with a high bar and a low bar, 2 of each, so that we have a nice variety of stuff. And then we have some wall space. And so we use that for a conditioning rotation, and then they jump on the tumble track to go back to the beginning.
So the girls who come in 3,
Days a week, one
they
day.
only do strength and conditioning on Friday, or do they do it as part of their rotations the other 2 days?
Yes and yes.
Okay, so they do their strength. So everyone's doing strength and conditioning on Friday, but the groups that come in 3, they'll do the other 2 days. They'll do it in their rotations, and then on your your kids who come in 4 times, they have a conditioning rotation every day.
Mm-hmm.
Okay.
The coaches coordinate to mix it up. So if they do abs one day, then the next practice they focus on arms or legs or backs, or like they coordinate it really well among themselves.
So I'm going to set up a scenario for Elaine, and Elaine, I'm going to ask you to help us. This is like an OSCE. This is like an OSCE.
Yes.
We did OSCEs when we were in our fellowship. So, but I promise I won't yell at you. So, on this scenario, let's picture that we are outside our 2-week window where we had fun and we did a whole bunch of movement that was counter our sport, completely opposite. Yeah. And that was fun. Then we've entered this 6 weeks phase where we want in the summer, let's say starting the second week in June through if we start the second week in June, we're going to be towards the end of July, right? We're going to have this 6-week period of progressive loading, progressively building up to where we peak the last week in July of our strength training. Can you tell me what that might look like on a micro level, week to week, right? As far as if we have kids coming in 4 times a week versus kids coming in 3 times a week, what are two options of how that program might look as far as body part. So let's start with just body part and like days and recovery kind of built in there. And then we'll come back and kind of talk about like your rule of thumb on each week, what we might progress our
Yeah, it's like from a percentage wise, right?
Yes, yeah. So start with first body parts and like trickle in the rest days. So start with the athletes for 4, and then you can go to 3. Yeah.
Yeah, so those 4 days, I actually like how she already presented it that way. It's like, hey, one day you're going to do specific just core. Like that's fine. Another day you're going to do upper extremity. Now that means like loading the shoulders, loading the wrists, loading the elbows. And then the third day would be like a lower half day specifically. And then a fourth day you can do a combination of all those days. Now for the 3, you can do core, upper, lower, or a combination of all those as well. But
So
like
you could do for the 3, you could do, if they're divided by breast days in between, you could do full body, full body, full body.
You can do full body if you really wanted to. Or you can just
Uh-oh. Hold on, Elaine. Your audio went out. Like it just got a little fuzzy. And you can still hear you, but it's quiet.
And yes, the 3-day a week kids have a rest day in between.
Yeah, thanks, Dawn.
so if they do the rest day in between, you can
So, hey, Elaine, hold on one second. Elaine, we're having tech issue. I don't know if you need to get closer to the speaker. I don't know what happened to your speaker, but all of a sudden the mic just like went crazy. Now I can't hear you at all. Why do we have so many Zoom issues, Dawn? I don't know. This is like good stuff too.
Yes, hold on.
Oh, wait, there we go. I can hear you. What did you?
Yeah. Are you good? Can you hear me?
Yes. Go.
Okay.
So 3 days.
Good.
3 days.
So 3 days, you can definitely do both upper and lower and like the same kind of day if you have a day, at least one day, if not 2 days of rest in between, especially during those first few weeks where you're kind of really loading those tissues. Definitely load both upper extremity and lower extremity. Now, examples of exercises that could include is like a handstand holds, right? Like if you're holding just for a few seconds for the upper half, you can do easy shoulder presses with light dumbbells for upper extremity. You could do dead hangs from the stall bars or from the high bars or even on the P bars. You can even do just like an L-sit hold, right? Like those, like more of like the isometrics, right? Like isometrics is those statics. Now for lower extremity, what you want to do is kind of those like static hold for like, say like a mini squat, say like you jump and land and hold. Or if you do a heel raise holding onto some weights or even with a weight vest and you just static hold either at the top or at the bottom. And then if you wanted to do just static hold lunges, or you can just do walking lunges with either holding dumbbells or if you're loaded at that point. So that's quite a bit of exercises that you can kind of do. Like that's just an easy example of exercises there. You can be a little bit more specific when it comes to gymnastics if you really wanted to for that, or for cheerleading or martial arts or whichever sport that you guys are utilizing. Now, as that progresses, right?
Now that's in the first, so that's in the first 2 weeks, right? So you're talking,
yes.
So those examples you just gave would be the first 2 weeks of starting a progressive load.
Yes,
right?
for my isometric standpoint, right? Like the isometric or those like a little bit more of like those static holds. And then the isotonic would be, okay, let's now do like from a swing, go into a handstand, right? Like on P bars, like let's go through the movement. Let's, instead of just static holding against a wall, or like, let's go through a handstand push-up or progressive phase of that. Instead of a plank hold, now let's add the push-up portion of it, or let's add like a inchworm into your plank hold, something so where you're kind of like going through a little bit more of your movement. And all of those you can add, or add some resistance bands. You can even add weight to those. Now, if you're going to be doing
even like that idea of the plank where you drag the kettlebells across. And then also, Dawn, I don't know if you remember in the core lecture, we did the sunflowers, where you
Yes, like an
come
Okinawa
through.
come around. Yeah.
Yeah, and you can add weight to that where you have like either they have a weight on their weighted vest on, or you can even have like a dumbbell, a kettlebell, a small kettlebell or small dumbbell. It wouldn't be heavy weight, but like they'd have to have good form. Sunflowers in general are already hard, so it'll only be a few that
Yes.
can do that. But like you can, that would be more of the isotonic type
Yes.
exercise.
And then from a power performance, let's take
So
the
wait, hold on. So how many weeks would we be looking? So the first 2 weeks, so this is our beginning of our summer. We had 2 weeks of fun. Then we're
two
week two
weeks.
into the June. The rest of June would be spent doing isometric
For
loading,
about 2-ish weeks, yeah.
2-ish weeks.
And then,
And
so
then
you're
the
looking at
isotonic
beginning of
one you're
July.
talking about, it would be, so
Yes.
the isotonic one would be how many weeks would we go from there?
I would do about 2-ish and then start adding a little bit more of that dynamic with the isotonic. So say, let's take the sunflower, for example. Instead of just the sunflower, why don't you do like a burpee where you like jump down into and then go into your sunflower, of course, making it just a little bit more power output, a little bit more dynamic.
And that also might look like, so what might that look like? Let's just say, so for me, I sometimes call these movement flows. I love kettlebell movement flows, stuff like that.
Yes.
So an example of, so we went from isometric the first 2 weeks, isotonic the next 2
Isotonic.
weeks, and then
And
from
then strength and
isotonic,
power.
huh?
Oh, post isotonic would be then like the strength and the power output.
So strength and power output for, so would you do that 2 weeks before you do the dynamic, the other stuff, or where?
Like into the dynamic. So like it's almost like there's an overlap of like going from the isotonic into the more dynamic.
And during the more dynamic, that's when you call it the superpower phase. That's what you're calling it?
Yes. Yes.
Okay.
Yeah.
So this dynamic movement flows that are weighted, that
Yeah.
are resisted,
Yes.
and you're
And
progressively increasing the
multiple planes of movement, and like going from floor to stand to kind of pressing overhead, kind of a little bit more of like you were saying, like flow type movements where you're adding, maybe instead of just focusing a lot on the upper half, it's combining the two, because that leads to a little bit more of kind of what you're going to do from a sports standpoint, is that we got to load both.
Yeah, like I love kettlebell movement flows.
Yes.
I also, love doing resisted band movement flows where they have to come
Yes.
one way and then go to another way, or
Through,
yeah, like some people call them chopping, or
yes.
like pulling the sword. Like there's
Yeah.
these patterns where you
The
pull across
peanut
the
pattern.
top,
Yeah.
and then you have one where you pull it and come across.
This way.
Sorry, I pull up and come up, right? That's
Yeah.
my the right hand punch, or the pulling the sword.
Yes.
These patterns resisted are always really good. And during this loading of 2 weeks, and then now we're into this, what you're calling dynamic superpower phase. How many weeks are we in there? Because we're already 4 weeks into it. So are we now
Correct.
2 weeks in?
Another 2 weeks, yeah.
Right.
And that's when we get into like you're kind of peaking now into a little bit more of that like strength and dynamic, like loading. Okay, now we can start adding like, okay, let's go into, okay, let's the vault drills, right? Because we've been working on a lot of like loading of the upper extremity. Let's go ahead and get into blocking drills, kind of loaded things where you're dynamically loading your upper extremity and lower extremity.
And I already can hear Dawn thinking, but we're in the summer trying to train upgrades. So how are we not doing blocking drills already in the beginning of the summer, Elaine?
Oh, yeah. So you should be doing some of those then, right? But like you should also be doing a little bit more specific for like, hey, we're noticing a lot of these individuals with maybe a little bit of that shoulder like instability. Let's start loading that.
Yeah. So I guess the factor, Don, and kind of in part of this answer, is that you are going to still be working your upgrades while you're doing all of these things. But you can start to shift your focus towards, instead of spending, because you're going to spend a bit of time doing conditioning and strength and all of this, and then you're going to shift towards more sport specific when you get done with
When you're getting closer to season, yes.
right, closer to season. So once they've finished, so first of all, when they're progressing through this 6-week phase, right? What percentages and where do they start as far as the loading goes? So when they're in the early phase, the first 2 weeks, the isometric phase, what percentage of their full body weight loaded? Like what percentage are we at? What are we adding?
5 to 10-ish%.
5 to
And then
10% of their body weight?
of their body weight
Okay,
is
so
what
at
you
the
can start
isometric phase,
adding.
5 to 10% their body weight added.
Yes.
And then at the next phase, which is the isotonic phase, the next 2 weeks, then what are we at?
You can add another, like I would say like 10-ish%, like at those next 2 weeks.
Okay, so they
And
add another
slowly
10%. And then when we're going into this superpower dynamic movement resisted, what percentage are we adding at that point?
you can add all the way up to, I would say probably about close to 25 to 30-ish%, like on top of their body weight.
On top of their body weight.
Yes.
Okay. And then after that phase, then we're headed into school, but we still have August, September, October, November, December, 5 more months.
Mhm.
So what's the process then during that 5-month period?
So then like those strength specific exercises, you're going to maybe start backing down just a little bit of the or the strength specific and start adding a little bit more sport specific. And then in those phases, you might start adding some of those exercises as more of your warm up as primers for what you guys are about to do in your training session.
Wait, which exercises are the primers?
Oh, the strength based exercises. If you whittle that down, choose 2 to 3 and use those as primers.
So like squat jumps, so like
Yep.
resisted squat jumps.
Yeah. Use it
And
as part
maybe
of your
some
warm-up.
kind of arm press of some sort,
Yeah.
so your big arms. Something I'm thinking, so when you pick those and whittle it down to 2 or 3, you pick full body or like big function movements.
Full
right?
body, yeah, bigger compound movements that are going to then mimic what you're about to do in your training session.
Mm-hmm. And you can throw them in as your part of your dynamic warm-up.
Dynamic warm-up, yes.
Okay, and then so does that stay that way for the next 5 months, or do they cycle in and out of any strength training, or do they stay with that superpower like movement pattern? Like where do we stay over the next?
So you can pick and choose now, like on certain days that you can kind of like, I would choose like 2-ish days a week where you kind of add that as your part of your dynamic warm-up, especially leading up to like peak time, because at that time you're pretty primed and ready to go. You don't need to spend that much time kind of priming and prepping your body for what you're about to do.
Right. Okay. And where do you fit in here so is that their only strength training though?
No, they should probably have like even in the season on their off day, you should probably doing some accessory work to where you're like doing a little bit more isolated strength training.
I'm just trying to figure out like before season even. I'm still stuck on that because like I'm just trying to follow. So I mean, are they dropping down to isotonics or isometrics, or are they staying? Because you said no, we're not staying at superpower. And we're
like
gonna
you can kind of weave in and out of that, but I don't think you need to necessarily all the way go back to potentially the isometric phase unless they're like actively like in that kind of inflamed phase. A little bit more the isotonic into the superpower phase is kind of like where you would want to be, like ebbs and flows. Yeah.
So you can trickle in some of these. So we did a very specific way of training during the
loading,
summer
yes,
and loading. And then we can take bits and pieces of that. And now they've already learned it. They've got a solid foundation on it. And then leading up to the 5 months before season, they can trickle in a little bit of each, but not try to overload because they're increasing their impacts, right? So when we're increasing impacts, we don't want to stay at that superpower phase while increasing.
Correct, because that might be overloading and overstimulating their tissues, which is kind of not what we want. We want them to be primed and prepared, but we don't want to overload them.
Right. Okay. So then you want to be kind of trickling in and out based on how many impacts you're doing in the gym.
Yes.
And then leading up to like our first meet and stuff like that, that's going to be more isotonic and isometric stuff thrown in as part of our workout.
Well, yes, as part of the workout. Yeah, as accessories.
Yeah, as accessories, because we're now doing so much sport specific stuff.
Correct.
Okay. Dawn, did that answer your question fully? I hope.
Yeah.
Yes. Okay. Good. And then
Okay.
Carla's question, I know Elaine has to go. Go ahead, Dawn.
Yeah, I
What
was
were
like,
you
I have to head out.
Yeah, we
I
got to
like, I
head
got
out.
patient, I got to too.
On the tapering off time, so that was helpful.
That was helpful,
Okay.
the tapering off. Okay, good, good, good. That's what I thought. Yeah, and then Carla, there's a PDF with some of these exercises, the how-to, we can kind of go through at some point. I know there's some video already of me showing how to do proper, it's on my YouTube, of how to do proper heel raises. And also we've done a bunch of jump training and squats there. So kind of going through the YouTube library on my YouTube, you'll see a bunch of that stuff that we've already covered over the last couple of years in there, as far as how to do it. And then we'll send you guys the PDF and the follow-up email. Elaine, I know you have to go because you have a patient. Thank you so much for following up with us. You guys can follow her on Instagram. She's, is it at PT Liftology?
Yes, at PT Liftology.
Yeah, so if you go to at PT Liftology, you can follow her there. Carla said thank you so much. And and then also, you guys, we are shifting over to a different link to Zoom. So if you've been saving this link, be sure to use the link from the next email that's going to go out, the follow-up email with the recording and also the PDF that Elaine is giving us. That'll have all of this breakdown for you guys. But also look for the new link. It'll also be updated on my Instagram. So next week we should be joining a different webinar link. It'll all look the same on your end, but it'll just be a different link than this one. And Dawn also said, thank you, thank you, thank you. So thank you so much, Elaine, for being with us. Have a great day. Appreciate it. Bye. Bye, everyone. I'll see you guys next week. You can go ahead and hop off, Elaine. We know you got to go. Next week, we have another special guest. It's going to be an amazing week. Hold on, let me get it straight because I've got a lot of really cool guests coming in from now until the end of the year. Next week. Oh, good. Next week, we have Coach Stokes from 28 Bands. So you guys see me with all the resistance bands that I wrap the athletes up. Coach Stokes is the inventor and founder of 28 Bands, and he's going to come in and talk about how to use the resistance bands. So we are actually going to go into the how, the entire session. I'm sure he'll talk about the why a little bit but I don't want us to spend too much time on the why because I think you guys have heard me say the why a bunch, but we'll say a little bit about the why. And then we're going to spend a bunch of time with the how and how to use the bands to your benefit with your athletes. So I look forward to seeing you guys next week. Look for the follow-up email. And again, it'll be a new link, which will be in the Instagram and on the follow-up email. Thank you guys for joining.